According to the Health Minister, Dr. Ruth Aceng, they want to estimate the extent of community transmission and where it is happening.
And compare the performance of various diagnostic tests that are currently available in the country, but others are also being manufactured and sent to the country.
The ministry has also categorized people of interest that will be contacted for the assessment.
We will look at the truck drivers and communities along their routes, the border crossing points and the communities along those areas. We will specifically also target health workers because they come into contact with patients. We will look at market vendors, religious leaders, the weighbridge areas and the communities around the weighbridge, roads, and law enforcement officers. We will also target the prison cells and teachers at selected schools, especially the teachers who stay within the schools who did not break off. We'll also target taxi drivers and the fishing communities. The blood samples will give us evidence of whether they have antibodies to COVID, meaning even if we don't find them sick, but if you have antibodies in your blood, it shows that previously you might have had an infection and fought it off, and now you're healthy.
The results from the survey will be very important, especially in informing decisions regarding the lifting of the lockdown.
Because as you plan to open, you also have to be aware that 1 or 2 cases may erupt somewhere and it may pose a challenge. So generally we have to prepare the entire country as we move towards considering a phased lifting of the lockdown. So this assessment will tell us if, for example, we find that there is a positive case in a market, then we shall say the markets are not ready. If, for example, we find a positive case in a school, then it will tell you that the schools are not yet ready. There is work that still needs to be done.
Uganda's recent confirmed cases of COVID-19 are mostly from truck drivers. 23 have since tested positive at the different border points from Kenya and Tanzania. Walter Mwesije, NTV.